Hi, I'm Dr. Donnelly with Solutions Integrated Medicine, and I'm here to tell you about one of the leading causes of visits to primary care doctors every year in the United States. There are over 100 million visits to the doctor for just this reason alone. It's actually estimated that 106.8 million visits to the doctor every year are because of arthritis, and it's specifically osteoarthritis. A lot of Americans have arthritis, and each of them is going to their doctor 2 to 4 times a year for that condition. That's a lot of visits, and that's a lot of dollars spent just for an arthritic condition. Now, you may think, this is probably because these people are old, right? Isn't arthritis something that happens because of our old age? But that's not necessarily the case. Think about this. You have pain in just one knee or one shoulder. But isn't that other knee or shoulder the exact same age? If arthritis was due only to old age, wouldn't that other knee or shoulder hurt just as much? Well, they would if it was only due to old age. But the fact is, arthritis is caused by a couple of different things. One can be repetitive use. Doing something over and over and over again will eventually wear out that joint. That's why a lot of people get arthritis from their jobs, something they're doing all day, every day, year after year after year. Construction workers or people who do labor jobs often have arthritis in the back because they're bending and lifting all day, every day. The other most common cause of arthritis is a previous trauma or injury. This could have been a car accident or a sports injury. Either of those things will cause arthritis later in life. It's estimated that 2,000 college athletes a year tear their ACL. Is that knee going to work like it did before, even after it's been repaired? It's definitely not going to be the same. Because of that, those athletes are going to have arthritis years down the road. In fact, in Major League Baseball, it's estimated they spent $665 million in 1 year on the salary of injured players and their replacements and surgeries. That's a lot of money. And it's estimated that almost 1/3 of all adults, these are active adults who have an above average activity level, are stopping their activities because of a self-perceived injury. That's a lot of adults that are not able to do what they want to do. So we have a lot of doctor's visits, over 100 million per year. That is a lot of dollars being spent on osteoarthritis. Unfortunately, spending a lot of money doesn't mean better health care. Spending more money on a condition or having more doctor's visits doesn't necessarily mean that the condition is going to respond better. What's important is that you find and spend money on the right treatments and have the right doctors to treat those conditions. In our clinic, we specialize in treating osteoarthritis, and because it's so common, we see it every day. It's the number one thing we do. We know exactly what to do with patients who come in with osteoarthritis, whether it be in their back, knees, shoulders, or any other joint in their body. If you have questions how we can treat you and find you solutions to your arthritis problems, please leave a comment or contact the office because we are happy to help with all of the answers we can. Thank you so much, and we look forward to speaking with you.